Going to get into the nitty-gritty of health insurance. There's a lot of basic terminology that is really important that you understand because everything builds on that foundation. So I am in your Fordney textbook. Chapter 16, page 305 is where I'm starting. So we are going to talk about health insurance. Okay. So long time ago, 150 years ago, there was no health insurance. You went to the doctor, you paid the bill, or you bartered or something like that. And around the 1920s is when health insurance was born. It started in very small areas. It was employer specific, things like that. And of course, it's grown to what it is today. In order for a person to have health insurance, there is a premium. It's what you pay to have the insurance exist. And it could be paid completely by the patient, or it could be paid by their employer, or shared between the employee and employer. If a patient is on Medicaid, that premium is paid by the state. Okay. So somebody pays for that policy. And it's like your car insurance premium. If you don't pay it, they cancel your car insurance. So it works the same way. If you don't pay the health insurance premium, you're going to get canceled. Okay. The person who carries the insurance is known as the subscriber. And so if you get insurance through your employer, this is the person who works there. Okay. Now they can have their family on the plan as well, but the subscriber is the one who carries the insurance, which would be the one who's employed. Okay. So when that employer decides that they want to offer insurance to the people who work there, they contact the insurance company and they design the plan. What is covered and how it's covered was designed by the employer. So what the deductible is, what the copays are, etc. Okay. The patient then goes to the doctor, gives them their ID card. The doctor's office bills the insurance, and the insurance pays it based on the contract. If it's something not covered, or there was a patient cost, like a deductible or copay, which we're going to talk about in a minute, the doctor's office then bills the patient for the part the insurance didn't pay. Okay. Oftentimes, patients do not understand their insurance. They don't know what's covered. They sometimes don't even know what some of these terms mean. So the front desk at the doctor's office or people in the billing department often are educating the patient on how their own policies work. Okay. So there are several different kinds of plans out there. Some of them are government sponsored. That's your Medicare and your Medicaid are your two big ones. And then we have private insurance, which are the non-government plans like Blue Cross. Okay. Most insurances are going to cover what is medically necessary for the disease or condition that the patient has. And every service is going to have a payment policy on what they determine medical necessity is. They're not going to cover things that are cosmetic, like a facelift. Okay? They're going to consider that maybe that to be cosmetic, and they're not going to cover it. Now, it may be cosmetic for one person, but medically necessary for another person. For example, if I just want a nose job because I don't like the way my nose looks, that's cosmetic. But if I was in a car accident and my face got smashed and my nose needed reconstruction, that's medically necessary. So just because we say nose job does not always mean that it's cosmetic. Okay? So doctors have to prove through diagnoses the medical necessity of those services. And then we have preventive care. Preventive care is services to keep a patient healthy. So the patient isn't sick, but we do these tests to to make sure that they're not sick, like mammograms, prostate checks, pap smears, things like that. That we want to make sure that if you do have a disease, that we catch it early. The earlier we catch cancer, the more treatable it is, the more curable it is. So it's very important. Okay. Other things are designed to keep you healthy, like getting vaccinations. Okay. That way you don't catch the disease that you were vaccinated from. So let's say polio vaccination or measles or mumps or something like that. Because it's cheaper to pay for the vaccination than it is to treat the person with the disease. Also, then you have all the risks of the disease, including sometimes fatalities. And so it's very risky to the patient if they contract some of those diseases. Okay. If you don't qualify for one of those government plans, Medicare and Medicaid, and you don't have an employer who offers insurance, or perhaps you are self-employed and you are the employer, the other option that you have is an individual health plan, which means that you buy it completely yourself and pay for it completely yourself. There's no employer helping you. Now, today, how you would do that is you would get it through the Affordable Care Act, through the marketplace. A lot of people still call that Obamacare. Okay. And you would go to the marketplace and you would price the different plans available to you. There is some government assistance to help you pay for it because you are paying for it out of your own pocket. And here's the plans that the marketplace has for sale in your state, because it is different from state to state, and pick one and buy it. Okay. And now you have insurance like everybody else based on the coverage that you purchased. One of the things that the Affordable Care Act did do that affects everybody, not just people who have Affordable Care Act plans through the marketplace, but every policy, even the ones through employers, the Affordable Care Act outlined a number of services that they consider to be preventive, like mammograms and pap smears and colonoscopies. And those kinds of services are now paid at 100%, meaning you get no bill at the end of those types of procedures. What that did is made those types of procedures more accessible to all of us. And so let's say I need a mammogram, it's time for my yearly mammogram, but I don't have the money. And I'm like, oh, it's going to cost too much. What we don't want is people to not get those services because of the cost. Because if we catch breast cancer early, it's very treatable, very curable. We also don't want a mother not getting vaccinations for their children because they're going to get a bill for it that they can't afford. We don't want adults for their children making decisions for those types of services based on affordability. So I had mentioned how the employer designs your coverages. Medicare and Medicaid designed it for the people who are in Medicare and Medicaid. And there's a variety of services. At least Medicare and Medicaid for sure, are very well-rounded plans. The majority of things are covered. But these are the different categories of care: hospitalization, surgical, basic medical and major medical, dental care, vision care. Those things are all separate components. Disability, they put it in here, but that's not health insurance. Disability insurance is like if you went and bought Aflac or something like that. This is going to help reimburse for an accident or an illness when a patient can't work. These are cash benefits that help replace your salary when you aren't working. This is not paying for your doctor's visits. This is paying some lost income, things like that. So while this is something the patient's going to get a check for from AFLAC, but they will need some documentation from the doctor's office to show that they can't work. So let's say I had a baby and the doctor tells me to take 6 weeks off to recover from having a baby. That's the typical norm. If I have this kind of plan, I can get my salary paid by AFLAC for my pregnancy leave. But I would need documentation from my doctor's office proving that I'm unable to work for that time frame. And of course, they throw life insurance and things like that. Those are completely different types of policies. Okay, so now we're getting into how the plans are structured. I already talked about the premiums. That's the amount that's paid every month so that the plan exists. When you have insurance, you get an insurance card. They all look different. Every insurance company can make it look like whatever they want it to look like. It's their plan. Patient gets the card. At the doctor's office, we want to make sure we get a copy of that card, typically front and back. A lot of cards, the back side has a lot of information like phone numbers and addresses. You want to make sure that you get a copy of all the information. Some cards are front only. Like in Michigan, where I am, Medicaid is a front only card for your normal Medicaid. Now there's Medicaid HMOs, that's a whole nother conversation, and there's backs on those. So you can see no matter what the insurance is, it's going to have the patient's information, phone numbers, policy numbers. Sometimes there's effective dates. Sometimes they list copays. There's just a variety of how it looks. When a patient gives you a card, it doesn't mean they have coverage for everything under the sun, and it doesn't mean that they don't have to pay a penny. We want to verify eligibility, meaning, is the policy even active? Just because I have a card doesn't mean it's active. I have a card, but I quit my job 2 months ago and it's not active anymore. But I still give it to you in the emergency room because I'm trying to be sneaky and get served. And I figure you'll bill me later. Okay. So we want to make sure it's active. And then we want to make sure what is covered and how it is covered. I'm going to pause and find the right page. Okay. So in order to verify eligibility or benefits, most insurance companies have online provider portals. You have to sign up and register and get a username and password before you can log in. Just any Joe Schmo off the street can't look this stuff up. And click, 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 I have it up on my screen. It's really super convenient and quick. If you have to call the insurance company, you might sit on hold for an extended amount of time before they pick it up. Okay. Right now, Blue Cross here in Michigan is really down on staff, I think. That the other day I sat on hold with Blue Cross to get a human on the phone for 45 minutes. So I just put my phone on speakerphone and did other things while I was waiting because obviously I'm not just going to sit here for 45 minutes and do nothing productive. So the websites are wonderful. The other thing I like about the websites is that it also allows me to work whenever I want to. I bill from home for a doctor's office. I can work late at night. I can work on Sunday. I can work on holidays. It doesn't matter when I choose to work because these websites are accessible 24/7 with the exception of some maintenance. Sometimes they bring them down, but every time they bring them down, I've always found that they do it like in the middle of the night. So really the only people it's going to inconvenience is like maybe your emergency room staff who might try to log in at that time of night. So if you do have to call, you're going to get on the phone with the insurance company. Most time you're going to start with an automated system. Press 1 for this, press 2 for this. So I'm going to put that I'm a provider, that I want this. Sometimes they have automated benefits where I'm still calling, but I'm talking to a computer, and other times I need to talk to a human being. We're going to punch in all of our policy information. So usually I have to put in my ID for either my tax ID or my NPI number so they know who I am. And then I give them their patient contract number, usually the patient's date of birth and name to prove who I'm calling on. And then they might then give me the information on how those claims will be paid. Okay, so this is the end of your intro to insurance for today. We're just kind of scratching the surface. We will delve in deeper later this module.